Hello, welcome to Medgre's video tutorial on screening a patient. Screening is the initial evaluation of a patient. It is intended to determine suitability for a particular treatment modality. You must screen a patient who has been checked in. In this process to screen a patient, you locate the patient details and then record details such as allergies, vitals, nurse's notes, review of system, and clinical history. Let us get started now. This is the home page of the Medgre application, and we are in the dashboard section. The dashboard displays the list of appointments for the current day. We will now search for the patient whom we need to screen. In the Scheduler widget, let us click the calendar control to select the date of the appointment. Now, enter the first name or last name or chart number of the patient in the search field. Then click Search. Do you see the appointment details for the relevant patient being displayed? We may also see other patients with a similar first name being displayed. Okay, now click Screening against the relevant patient. The screening pop-up displays the appropriate process. After you have read it, click Continue. The patient chart with the nursing station selected is displayed. Here, we need to enter details for allergies, vitals, smoking status, nurse's notes, review of system. Let us now access the Allergies widget to record the relevant details for the patient. Prior to recording the details, let us understand the widget. You click Active to display only the active allergies related to the patient with details such as allergy name and type, severity of the allergy, results of this allergy on the patient body, and start date, that is, when the allergy was first detected. You click Inactive to display only the inactive allergies related to the patient. In addition to the details displayed while selecting active, the end date, that is when the allergy was cured, is also displayed. You click All to display both active and inactive allergies. Now let us enter details for allergies. Click Add/Edit in the Allergies widget. The Allergies pop-up is displayed. From the Type drop-down list, select the type of allergy. From the Name drop-down, select the allergy name. Severity of the allergy may be selected from the Severity drop-down. The allergy results in a condition which has to be selected from the Resulting in field. When a condition is not available in the drop-down list, click Add New to add a new condition. The allergy may have been detected on a certain date. Pick the date by clicking the calendar control against the start date. Select the NKDA checkbox if there are no known drug allergies. Click Add to add the details. A message stating successful addition of allergy is displayed. The allergy is then displayed in the table given below the fields. If the user adds any drug allergy, then it will get updated on the Arcopia Dr. First also. We will now close the pop-up by clicking the X symbol given at the top right-hand corner. The Allergies widget now displays the entered details. Do you notice the allergy checkbox being selected on the process bar? It is automatic so as to indicate the completion of the allergies details. Similarly, when other processes are completed, the other checkboxes will be selected automatically. Let us now access Vitals to record the relevant details for the patient. In the Vitals widget, click Add/Edit. The vital signs pop-up is displayed. Note that the mandatory fields are the ones marked by a red asterisk. Let us enter the details now. Select the Vitals Not Done checkbox. If vitals are not done for the patient, select a reason for not doing the vitals from the drop-down list. If vitals are to be recorded for the patient without selecting this checkbox, enter the following details for the patient. Blood pressure, diastolic, systolic. Pulse rate. Temperature. Weight in pounds. Height in inches. Note that the body mass index is calculated automatically. Respiration details in minutes. Percentage of oxygen saturation. Waist circumference in inches. head circumference in inches. Select a status for smoking from the drop-down list. If the patient is a smoker, record the number of packs smoked per day and the number of years since the patient has been smoking. Enter notes, if any. Now click Add. A message stating successful addition of details is displayed. The details are then displayed below the fields. The Vitals widget now displays the entered details. Let us now access Nurse's Notes to record the relevant details for the patient. Enter notes, if any, in the Nurse's Notes field. You can enter multiple notes for a single data visit. Click Add. The details will be displayed in the box given below the field. The Nurse's Notes widget now displays the entered details. We will now enter the Review of Systems information. The Review of Systems pop-up is displayed on clicking Add/Edit. Click a relevant category, for example, General, Eye, Respiratory, and so on. Select the relevant checkbox that specifies the patient's condition related to this category, for example, tire easily and marked weight change in the General category. You may enter the other required information accordingly. Click Save. You will notice the details displayed in the Review of System widget and the relevant option reviewed is selected automatically. In the subsequent widgets, data will get copied and none of the options will be selected automatically, and the user can select any one option. Having completed the nursing station, let us now enter details for clinical history. From the left menu, click Clinical History, or the Clinical History page can be accessed by clicking on the Clinical History process bar. The Clinical History window is displayed. It comprises of a few widgets. We will start with the Medical Profile widget, which comprises several tabs. Click Add/Edit. In the resulting pop-up, click the General tab to enter information. The General tab comprises information about the patient's medical profile, such as details of physicians and dietary restrictions. You may record the details. If the patient is under the care of a physician, select the Are you under the physician's care now checkbox. A drop-down list to select the physician's name will be displayed. Select the physician's name. If needed, select the Referring Physician checkbox. A drop-down list to select the physician's name will be displayed. Select the physician's name. If the patient is on a special diet, select the Are you on a special diet checkbox. A field is displayed to enter the relevant diet details. If a patient is using controlled substances, select the Do you use controlled substances checkbox. A field is displayed. Enter the first three letters of the substance. From the data that is displayed, select the substance. Now click the Medical History tab. This tab stores medical history details about the patient. From this drop-down list, select the relevant diseases and click Add. The name of the disease is displayed. Select the Active checkbox if the patient currently suffers from the disease. Click the Calendar control to specify the start date of the disease. Now, click the Surgical History tab. If the patient has undergone any operations and surgeries, select the details from the drop-down list. Click Add. The details are displayed. Click the Calendar control to select the date of operations and surgeries. Now, click the Injuries and Hospitalization tab. If the patient has any injuries or has undergone hospitalization, we will record it here. Select the details from the drop-down list. Click Add. Click the Calendar control to specify the date of the injuries or hospitalization. The Women-Related tab is enabled only if the patient is a woman. Select the following checkboxes that are appropriate to the woman patient. Are you pregnant? Are you trying to get pregnant? Are you nursing? Are you taking oral contraceptives? The Health Maintenance tab stores general information about patients' health maintenance details. If a patient suffers from one of the conditions, select the relevant checkbox. and then click the calendar control to select the next due date for health maintenance. Click Save. The details will be displayed in the Medical Profile section under the relevant tabs. Let us now access the Immunizations and Shots widget to record the relevant details for the patient. Click Add/Edit. The immunization pop-up is displayed. Note that mandatory details change based on the option selected, such as Other Provider, or Vaccine Not Done, or Administered. The mandatory fields are the ones marked by a red asterisk. Select an option for immunization, associated vaccines, site of injection, routine. Click the calendar control to select the administered date. Click the time control to select the administered time. Enter the amount of vaccine administered, unit of administration, and lot number. From the drop-down list, select an option for Administered By. Select Yes or No for VIS. Finally, enter the manufacturer name, manufacturer code, and notes, if any. Okay, now that the details are entered, we will record them by clicking Add. The details are displayed at the bottom of the immunization pop-up itself and in the Immunization and Shots widget as well. The Family History section manages the medical history details of the patient's family. Click Add/Edit to invoke the Family History pop-up. We will now enter the details. From the drop-down list, select the relationship of the family member to the patient and the health condition of the family member. Then, enter the age of the family member. Select this checkbox if the family member is alive. If the family member is not alive, enter the reason for death. From the drop-down list, select a disease that may be afflicting the family member. Then click Add. The family member's details are displayed at the bottom of the window. You also see the details displayed in the Family widget. Let us now access the Medication Other Physician OTC widget to record the relevant details for the patient. The Medication Other Physicians OTC widget displays information about medications prescribed to the patient by any other provider or details about the over-the-counter medicine being taken by the patient. Click Add/Edit in the Medication Other Physician OTC widget. The Medication Other Physician OTC pop-up is displayed. In the Medicine field, enter the first 3 letters of the medicine's name. From the list that pops up, select the relevant name. Click Add. The details are displayed below the Medicine field. Select the strength of the selected medicine from the Strength drop-down list. Example, 10 mg, 20 mg, and so on. From the drop-down list that displays OTC, select whether the medication is available over the counter or whether it is prescribed by the other physician. Click Save to save the details. The details are displayed in the Medication Other Physician OTC widget. Let us now access the Social History widget to record the relevant details for the patient. In the Social History widget, patient social history details are managed. You may record the details by clicking Add/Edit. Let us enter the details. Enter details about the place of birth. Select options for marital status, current occupation, previous occupation, education, and who lives with you in the household. Under Lifestyle, enter number of hours per day of sleep. Then select an option for temperament. Now, enter the number of hours of day of exercise and select an option for recreation. Record whether the patient is an alcoholic, sexually active, has had STDs, and whether they abuse drugs. If the answer is yes for the above items, please capture the sub-items. Example, if a patient is alcoholic, then choose the type and habit from the drop-downs. Click Save. The details are displayed in the Social History widget. Do you notice that all the checkboxes on the process bar got checked automatically? Click the Done button on the extreme right of the screening process bar to complete the screening process. If any checkbox is unchecked in the process bar and the user clicks the Done button to complete the screening process, a confirmation pop-up showing the message, "A few items in this process are still not completed. Do you want to mark this process as done?" will be displayed. If the user still wants to complete the screening process, then the user can click the OK button. And when the dashboard is displayed, do you notice that the patient is now waiting to be examined? We are now done with the screening process. In this process to screen a patient, we located the patient details and then recorded details for allergies, vitals, nurses' notes, review of system, and clinical history. If a patient is a follow-up patient then, the user just needs to review every section and can make changes if needed. Thanks for watching the video.